Hey everybody, I'm fresh home from the clinic. That's why my face looks like it does. I'm in my comfy clothes and I decided to answer a few of your BSE questions. I got a ton. You guys really came through. But I'm going to answer a few of these before I go fix supper, and then maybe in another day or so I'll try to tackle the rest. And I think Dr. Kojal, actually, she offered to answer some of them too, so you're going to get to hear it from the real expert. Before I get started, you may hear baby chicks in the background. My office is a shed in the yard, and it's also our meat bird starter area. So I have like 21 baby chicks in a horse trough right here in front of me. So if you hear the little birdies, that's what they're doing. So the number one topic I got questions about, and I knew this one was going to win, is what do I do with the different sperm morphologies? So I get frustrated trying to figure out what abnormalities they are and what I need to tell the owner. My number one question regarding bull testing is remembering what to classify as head versus mid-piece tail, and then what it means and what to tell the owner. Remembering what I'm supposed to classify them as, prognosis of abnormal sperm morphology, prognosis for bulls with high percent proximal droplets, what to tell producers based on abnormal morphology. I mean, you guys asked a million great questions about that, and I knew that would be a big one. So try to tackle some of them asked kind of specific questions, so I'm going to tackle some of those. This issue is a huge one, and it's a critical part of the BSE. And so I had one asked specifically about, you heard that question, with a high percentage of proximal droplets. So of course we have those sperm that are that have that droplet right up at the junction of the head and the mid-piece. What do we do with those? So my general rule for those is, if they are a young bull, so in that kind of yearling age, or even in the Bos indicus, even when they're 16, 18, and sometimes up to 2 years of age, if they're full-blooded Brahmins, in young bulls, generally, the proximal droplet is a sign of immaturity. And so I put those bulls off, I give them another month, retest them, and most of those bulls, in my experience, will pass. Back when I used to test like 100 yearling bulls for a sale for a guy, I used to flunk about 30% of those on the first test due to proximal droplets primarily, and that was just immaturity. And so those guys that are testing yearling bulls need to start testing them early, especially if they're going to go to a sale, to make sure that they mature enough to pass on proximal droplets by the time they get to the sale. I also had a question about distal mid-piece reflexes. And I'm going to use a veterinarian actually sent me an image as a question. And so I hope she doesn't mind. I'm actually just going to use her image because I think it's great. So if you can see there, she's got the black. We'll look at the circled black ones first of all. And those are actually called bent mid-pieces. So those are not distal mid-piece reflexes. Those are just a bent mid-piece. And you can just see kind of how that tail is like somewhat softly whipped around. That usually means that you just caught him mid-whip. And so I don't count that as an abnormality. Just if it's got kind of a soft curve to it like that, and even those ones that are circled in green, I don't get too excited about that. That means you caught that guy kind of mid-whip. And so those I do not call distal mid-piece reflexes. The other thing is, you notice is when we just stopped talking about proximal droplet, that one's a good example of a proximal droplet. So I would classify that guy for sure based on his proximal droplet. What the definition of a distal mid-piece reflex is that it has a droplet at the reflex. So I pulled up a picture of that for you too. It's kind of blurry when I make it giant. But if you look at that, you can see there's that tail that's whipped completely back 180 degrees, but there's a droplet in there. That is a distal mid-piece reflex. If, however, you see a sperm that looks like that but does not have the droplet, that can be an osmolality change, and that can be iatrogenic. I have seen those guys show up like when it's really humid and my stain kind of has more hydration to it, I guess. than normal. So that can be a handling or a staining artifact. So distal mid-piece reflex, that tail's whipped back around 180 degrees, but it's got a droplet in it. If it's just curved, kind of a soft curve, that means you just caught him at a bad moment. And if it's whipped around and has a droplet, then that is the abnormality. That is the distal mid-piece reflex. So hopefully that helped out with some of those. So let me see if there were any other specifics in those questions. So those were the ones that were specifically asked about, those abnormalities. What I will tell you guys is I've been testing bulls for 20 years, and I learned a ton in the morphology module of Dr. Kojel's on the site. I took a bunch of notes, and there were things I'd forgotten. It's so, even if you're been out for a long time, it's easy to forget exactly what that classification means. And she goes through the most common abnormalities, exactly what they mean, and exactly what it means for the bull and what to tell the producer. And then she has a set of notes that goes with it, so you can jot little notes down to yourself as well. Maybe create your own little chart or whatever. She actually does have a couple of charts in there that are kind of nice, that are really nice. And so I think you'll find that morphology portion of that set of 3 modules really valuable, because when I had her do the first bull BSE module, I specifically went back to her and said, I need you to do one just on morphology, because everybody needs to know about morphology. Next question was, what do you do with a bull that has a good collection but poor morphology motility? I have recollected them, and some bulls give a passing sample the second time. Should I recollect all failing bulls? I would say yes to this in the absence of evidence that the bull has a penile injury or some reason that he should not be collected again. So my personal rule is every bull gets 3 chances to pass. So you kind of always give them that first one, especially that man I got on cows, to kind of be the clean out rusty load one. And she talks about the abnormalities that we typically see with a rusty load. So that first one can be just a clean out. I'm cool with that if they flunk that one. Then I collect them a second time, give them a break, collect him the second time always, unless, like I said, he's got an injury or I found something really abnormal and I'm not going to collect him. I'm going to collect him the second time. Usually that second collection will be markedly better, if not passing. And so, yes, the direct answer to your question is I do recollect those bulls. I will, if they are close to passing on that second one, I will recollect them the third time then. After 3, I think you got to give him a break, or, make a decision about whether he's going to make the cut this year. Whether or not the guy has time to hold him over until breeding season. These guys that show up with the trailer and they're like, as soon as you pass him, I'm dropping him in the pasture on the way home. They don't give those bulls, a chance to recover. So if you have time for them to recover, you can retest those bulls. But again, a lot of that goes back to what the abnormalities are that you're seeing. Are they ones that are potentially ones that they can grow out of, or can likely that they can recover some. So yes, I do give every bull at least 2 and sometimes 3 chances. Some people may say 3 chances is too much. I definitely wouldn't argue with that, but I do provide that sometimes. How do I get bulls to extend that will not? So that's a great question. Couple of things. One is I manually collect those bulls on the machine. I don't run them on the program. Sometimes I find the program doesn't suit some bulls. I mentioned that in the video where I talked about them laying down in the chute. So if they won't extend, I run them by hand and see if that helps. I will go and massage them and see if at least they will drop it. So we can remember, you got to see the full penis to pass them because of the possibility of adhesions and warts and all kinds of stuff. So I will massage them and have someone watch and at least see if we can get them to drop the penis so that we know anatomically it's normal. There's no cuts or, whatever on it. but I find that running them on manual, sometimes I can get them to extend when they won't. The other thing I'll do is if they will stick it out a little bit, not quite out, I will take a 4x4 gauze, reach up there and grab the tip of the penis and extend it myself to see that it's abnormal. Now, what those things, like just watching them drop it flaccidly by you rectaling them, or me grabbing it and pulling it out, what that doesn't tell you is, can he achieve an erection? And that's a critical thing to know. Some bulls just won't do it on the machine. And so I always put a note on there that somebody needs to see this bull breed a cow, or they need to be taken to a bull stud and put on a jump steer and see if they will extend and make sure that they're normal. So I don't let them leave my place until I've seen the whole penis one way or the other. But then somebody needs to see them with a full erection. So I find pulling it out manually massaging them rectally, running the machine on manual versus the program, you can sometimes get those bulls to respond a little bit better and at least allow you to see the whole penis. Then you got to work on the can he get an erection part. So number one question, how do I get more guys to do it? Meaning, how do I get more clients to test their bulls? And this is certainly a battle. I put out a statistic, I think it was in one of the emails that came out this week, and it's in Dr. Kojal's module. She presented that they looked at the prices of BSEs kind of around the country. The average was about $70 per bull. And they showed that for every $1 that the client spends on BSE testing, bull evaluation, they will get almost $7 back, $6.80 back. That's a 680% return. So that's pretty important, I think, there to make sure that we present to them. The other thing is, wait around until they have a disaster. And that's a terrible answer, but a lot of people have to learn the hard way. And so I tell them stories where a guy has had 50% preg rate. So I really hit them pretty hard with the horror stories that I see and let them know, like, listen, you're spending $70 to potentially keep yourself from a 50% preg rate, or a bull that's got a penile hematoma and can't extend his penis because he's got adhesions now. And so I'm not shy about sharing horror stories, but I think this nearly 700% return should be told to all guys. I think that can be very helpful. So you just have to, and the veterinarian that sent this question in, he's kind of a smooth talker, so I think he can find it. Most of us are. I think he can find a way to creatively present his horror stories. What about seminal vesiculitis in yearling bulls? Go in there, palpate firm seminal vesicles. What do I do with those? What's the prognosis? Again, a lot of that has to do, are they going to a sale and how long do they have to get over it? But the evidence leans towards the use of macrolides for those bulls. And so, telanthromycin, tolmicin, those have typically been shown to be the most effective with seminal vesiculitis in young bulls. So I defer those bulls and treat them, and then recommend a retest, repalpation in a few weeks. Let's see how he's doing. Has he cleared the white blood cells? Has he done those kinds of things? So another question I get, it's not in here, but I get it a lot, is how do I determine if a firm seminal vesicle is active seminal vesiculitis or just something that he had when he was younger? I squeeze it. So I go in there, and if I feel a seminal vesicle that's firm, I, give it a little squeeze. And if he says, ouch, hunkers down on my arm, that's probably active inflammation, and he's got active inflammation. A lot of those bulls also will have pus or white blood cells in the semen, which kind of confirms that. If it is, I go in there and squeeze it, he doesn't care, and the semen is clean, no pus, no white blood cells in there, then that's probably seminal vesiculitis he had some time ago, and it's probably unlikely to be causing him any problems now. So that was almost 15 minutes. I didn't plan on it being that long. I get really excited, but I hope that helped. If your question wasn't answered, do not fear. I'm gonna keep doing this until we get every single person's question answered. I've got a spreadsheet, and we're just gonna go through them, and I promise to get them all answered for you. You guys have a great night.